Hi, my name is Dale Baker. I come from Colorado in the United States, and I came down to Costa Rica to get a hip replacement. Well, my wife and I, Lynn, had been to Costa Rica, and we knew that the medical industry here in Costa Rica was very professional and very good. So when this problem occurred, one of the first countries we thought about getting the procedure done was Costa Rica. We also thought about possibly Europe, but it's a lot more fun to rehabilitate in Costa Rica than Europe in the winter. Everything has gone very professionally, from being picked up at the airport. I'm by myself, so you've been very helpful. You picked me up at the airport, found a nice hotel for me. The people at the hospital couldn't have given me better care. They were all very concerned about my well-being. And of course, Dr. Ording, I think, did a tremendous job, and he also was very concerned for my well-being, and he answered all the questions I had after the surgery. So I'm very comfortable with everything that happened here. Well, probably the only thing that would have helped me more, being by myself. I had to do a lot of things on my own, and I understand that most people, when they come down to Costa Rica to have a procedure done, they're usually with a helper. Especially the first couple of days after surgery, I probably could have use more assistance.
A little extra hand.
But I, as far as doing some of the normal things that you take for granted that are pretty hard to do after having a hip replacement. But after 2 days, I was fine, and everybody has been very good, including obviously yourself, communicating with me and helping me whenever I had a request. So, before the surgery, my condition was getting progressively worse. For the last 8 months, I've had a very bad hip, and it got so that the last 2 months, I could hardly walk, and I had to start using crutches. I was trying to wait until I was 65 years old, because then I would have been on Medicare in the United States. But it just got to the point where the pain was so intense that I knew I had to have something done. And in fact, I may have damaged, if I had gone on much longer, I might have damaged other parts of my body by compensating. And so I feel a lot better today, 9 days after the surgery, than I felt before the surgery. So then I'm looking forward to a total and complete recovery. I came down to Costa Rica because at this time, I do not have health insurance in the United States. And the procedure would have cost a tremendous amount of money. And so coming down to Costa Rica and having the professional care that I've received, spending the amount of money that I have, has been very beneficial to me. And it's saved, obviously, myself a lot of money. And I believe that anybody that's in a situation like mine, that needs great medical care, and medical care is not available in their country that they can afford, I would recommend Costa Rica very highly.